Hello, my name is Monica Brooks, and I am in the sterile processing technician class. And I am going to be opening up my surgical kit for Unit 1 assignment. These are all my instruments here. On the table. Okay, so these are all of my instruments. Starting off with this instrument here, this looks like a scalpel holder or a blade holder. You would put the blade, whatever size blade, into the holder here, and it'll clip on. And it looks like it is used for cutting anywhere on the body, just to make an incision or to open up anything. And it could be used in any type of surgery. Let's see what else. This instrument here, I really don't know what this is, but it looks like it's used to retract some type of like tissue. That's what it looks like. It looks like it can be used in somewhere that is smaller. Maybe like the arm or the leg, foot, hand. It just looks like it's used somewhere smaller, or like a small space. Let's see here. This looks like a suction. Looks like a suction. It can be used in any surgery. And yeah, it looks like it's a suction. And then the last one, I would say, this one here, it looks like a clamp, like a hemostat, to clamp any type of like vessel or artery or anything to stop the blood flow at the moment. And then this can be used in any type of surgery, I think, as well. Or maybe like something smaller, since it's on the smaller side. So those are the 4 instruments that I picked out. And then I'm just gonna move these all to the side here. And then these are my flashcards, my instrument flashcards here. I'm gonna pick 4 cards. Okay, so on this card, it says, what is the name of this instrument and what type of procedure is this instrument used on? This is the instrument and this is the card. This looks like it will retract something or hold something back. Like I would physically have to hold something back with it. I don't know the name of this instrument, but I'm thinking it's something with retracting. And then on the back of the card, it says the name of this instrument is a Bennett retractor, and it's used for retracts tissue during large orthopedic procedures involving the femur. So I think I did pretty good. I guess the retractor, it is a retractor. I like that these flashcards, you know, show the picture, asks you the questions so that you can try to answer them yourself. It does seem logical that this will be a retractor because that's what it looks like. And yeah, so on to the next card. It says, what's the name of this instrument and what category is this instrument? Not sure what category means in this question, but this is the instrument, this is the card. I would call this like a separator, only because it has the 2 ends there, and then you would have to separate something, and it might like lock into place to keep it opened. So it says that the name of this instrument is a Gellipi retractor. The category is self-training, very sharp. And that's what it looks like. That seems logical. A retractor is to open or retract something. It looks like it'll lock into place and stay there. So that makes sense that it's self-training. The next instrument is this. It says, what is the name of the instrument? What category is this instrument? This also looks like it retracts something, but it looks like I would have to physically retract it myself and hold it into place. It does say that this is a gullet and it is a handheld retractor. So that makes sense because that's what it looks like. And for the last one, this is the last instrument here. What is the specific name of this instrument arrangement and what kind of suture can be used? So if they're talking about sutures, to me, this would be a needle holder or used for suturing. What kind of suture? Just with my experience, I would say a larger needle or a larger suture. But let's see. So the answer to the first question is armed tie, aka tie on a pass. And what kind of suture can be used? Any suture can be utilized. Interesting. And that's the back of the card. So that concludes my assignment 1. I think that I really like that Herzing and this course provides the instruments so that I have a hands-on learning. And these flashcards seems to be very helpful because it's things that I don't know. I think that I would take the necessary steps to look up how to pronounce them accurately. But I really like this surgical kit. I never had anything like this before in my studies. So thank you so much. And that concludes my assignment.